Good afternoon, everyone. This is Megan Fournier with the Home Care Alliance Massachusetts. Thank you for calling in today. This is our first session of our new innovation series that we're trying to introduce to our members throughout at least the next year coming that we have. We felt like it was really important to try and introduce you to different products that are available that you might not be aware of. With all the new regulations and everything like that going on, it's easy to lose track of the simple things that could be, really valuable to your agency. So that's kind of why we introduced this free series. So just a couple of details before we begin. First off, you are in mute only, and that's mostly just because of the outside distractions. We just want to make sure everything runs smoothly. We will address questions at the end, but you can write them at any time. So you would just do that in the sidebar in the questions tab. And then again, you'll stay in mute only, but if you write questions, I'll read them aloud and then we'll get them answered for you. This is recorded, so for some reason if something technical goes wrong or you want other staff to listen to it, it will be made available afterwards. And I think that's it for normal logistics. So with that, I'm going to hand it over to Anand for our first session with Vera.
Great. Well, thank you, Megan. I appreciate the opportunity to speak to you and speak to your members as well. Thank you, everyone, for joining this afternoon. I'm on the West Coast here, so thank you. Greetings and good morning from the West Coast. My name is Anand Choksi. I'm a physical therapist by trade. I am the Chief Clinical Officer at a company called Reflection Health. At Reflection Health, what we're trying to do is really to change the way, or just kind of look at other ways to help patients. I kind of left traditional care 5 years ago when, I've always felt there was another way to help patients beyond when they're in my clinic. I'm an outpatient physical therapist by trade. And a sports med, and I said there has to be another way to help my patients just beyond when they're in my clinic. And with technology coming out day in and day out, how can we kind of use technology to help aid us in providing better care? As a company, that's where we kind of started when we started this company over 5 years ago, helping with leveraging technology to help help patients, help get more data on what patients are doing outside of the visit, to understand how to better interact with them when we do see them in person. So we started, just to give you a little bit of a history, we started just over almost 6 years ago now out of an organization called the West Health Institute. It's a research organization down here in San Diego. This organization is really built on helping the aging, helping seniors age in place and at home, and also helping to find ways to help manage healthcare dollars. As a company, we were able to get some funding, and we got FDA clearance for our software back in 2015, and have built various different partnerships along the way with healthcare institutions, other home health agencies, as well as some outpatient private practice physicians, and even acute care facilities like Brooks Rehab down in Jacksonville, Florida. Recently we just completed a randomized control trial with Duke Clinical Research Institute, where they ran the trial and used our technology to examine the effects of cost savings as well as outcomes on the patients using technology with clinical oversight and compared to traditional physical therapy. So, why should home health care about technology, right? That's the big thing. I think that's where we always like to think about why should home health or physical therapy in general care about that. When you look at the current state of home health, talking to a lot of home health and physical therapy providers out there, they always talk about the labor shortage and the high turnover potentially of home health providers. So this is where the ability to leverage technology to help with some of those inefficiencies comes into play. As we all know, the geographical limitations that is involved with home care, especially trying to improve access to care for members or for patients in the area is always difficult. To maybe cut down on some of that travel expense. Right now with the revenue, with the current state, we know the current state of revenue is tier-based. with Medicare, and currently there's a 60-day episode of care that's there. But I know there's a bunch of new proposals coming out. We can shorten that to even 30 days as well. So when we look at this, we think of how can technology help or benefit home health. We looked at to create a little more accountability. I think part of the physical therapy is extremely important. Physical therapy, and I say this, as a physical therapist, a lot of it is not rocket science. I think a lot of it is, if we all believe that, if the patients will do more to help themselves or be more proactive in their care when we're not with them, it can help drive potentially better outcomes. So that's where, technology can help with increasing accountability and improving that adherence, right? And as by doing this, we can help manage the cost of recovery. And this is where we've looked at doing studies, doing clinical research to prove that not only are we able to achieve high satisfaction, patient satisfaction, and really good quality outcomes equivalent to traditional care, but we're able to do this with better labor efficiency and better cost savings, because we're able to provide better insight as to what patients are doing in between the home health visits or even in the clinic visits. And by doing that, we get to triage, a little bit to understand whether or not an in-person visit is really warranted. And what that does with reimbursement kind of moving this way, it helps to drive better alignment with this risk-bearing model that's out there now. So, one of our valued home health care partners is the Visiting Nurses of New York, where they're using it to help to help to enhance the care that they're delivering to their patients in the home. So to deliver and understand what that patient is doing beyond. So not only are they understanding what they're doing, but they're also within our software, which I'll kind of show you a little bit later. They have the ability to do virtual check-ins remotely, to be able to do a check-in to see how is that patient doing in between visits, to see if anything needs to be escalated, to answer some questions for that patient, to really, as we all want to do, is provide better, more comprehensive care for that patient. Their goal for all this is to really, for them, is to improve the tracking and better outcomes, and to really, really help them in those case rate alignments that they have, or their relationships that they have with entities that are in a bundle environment or a value-based care environment. So how can technology really help with providing care? So we talked about increasing patients, I mentioned already, increasing the patient satisfaction and adherence, to really understand what they're doing at home, to improving access to rehab with a home-based solution. So really understanding, again, helping them understand what is expected of them, and while they're at home, kind of regurgitating some of the stuff that they would hear from a clinician in terms of how to, what are the signs and symptoms of an infection, continuously help to set expectation and continuously give them the information at their fingertips, which is really easy. Something which I think is really important is to really maintain that consistent quality of post-acute care management. There's a lot of variability at times, and this can help drive a little more consistency with that. And to quantify, get that quality data and understand what the outcomes are, and then to tailor that based on what the need is of the patient. So everything is always based on the clinical need. The drive is not to reduce clinical intervention. Actually, I would say with healthcare technology, you're probably having more touch points with the patient. But what you're doing is that you're understanding better how you can tailor that utilization based on that clinical need of the patient. And then really what we do is really with the technology is triage who needs that intervention, who needs to be seen immediately, who needs to be recommended, suggested to go see a doctor, or if worst case scenario needs to go to urgent care or an ER. And all of this helps to control that post-acute care cost and variability. As we all know, different areas of the country, different areas of town, different agencies all have different, I guess you can say, cost variability to usability and variability of cost when it comes to providing care. This can maybe help to drive a little more of that uniformity across that line. And the main thing is to achieve better outcomes with the patient. So what I'm kind of showing here is a little bit of an example. I think when we talk to the home health care agency, it's always hard to understand because you're reducing visits. And what I like to say is we're trying to enhance the care versus reduce visits, but at the same time as you try to enhance care, yes, there's a difficulty of the reimbursement model being tiered. This is an example from the visiting versus the New York Manhattan area. So everything is different in different regions of the country. But what I want to try to drive across here is a little bit is that, if you can get to that lower tier level of 5 to 6 visits, or 6 visits, you are able to have, I would say, a higher revenue per visit model. I understand that it's sometimes beneficial to go to a higher revenue model. You want to get to the lower end of a tier because that's where you have a higher revenue per episode. But what we worked with our home health customers and partnerships is really driving a little bit different thinking of we're trying to look at more of the revenue per visit more than the revenue per episode. So kind of looking at that a little way, if you have kind of a single therapist who does 12 visits in the home, right, and sees a patient for 12 visits in the home, that can be roughly $4,400 based on the previous slide. So that is roughly $370 per visit. So now with the potential shortage of providers that we have in home health, we would like, and the increase in referrals or demand that's needed, and patient needs higher access to care. If we were to able to manage patients now, one therapist is able to manage 2 episodes of care for 6 visits each, so the same 12 visits, rather than getting $4,400, you're kind of getting in that 6 visits episode of care, you're getting $3,100 per episode. So now, in theory, you're getting, for the same 12 visits, $6,200. So you're getting more revenue per visit now, right? And as you're increasing that revenue per visit, you're also kind of helping with your productivity of your FTE, right? They're now able to see the same amount of patients. Now, again, everything is always driven on the clinical presentation. This is all good in theory, but this is where you can't just reduce visits from 12 to 6, because that's probably not the right thing to do for the patient. But how can you help drive models to get you to that 6 visits? That is where technology comes in. Using technology to help you manage the patient better at that kind of more optimal level is the key thing. And that's where technology in general comes in, and using kind of this, as we call it, as we train and as we help our customers, is this PT navigator model, where the therapist provides the in-person kind of care in between that in-person clinician visit to help support that patient's recovery and support the clinician who's going into the home as well. So it's really more of a coordinated care effort. Again, this will all drive better, I think, episode costs, right? A little bit lower episode cost, but then that will increase the attractiveness of your organization to entities that are in bundled or capitated care environments. So this potentially can help to increase referrals to your agency, because now you are now a lean and organized machine where you are more in that lower end of the tier and still providing quality care, high patient satisfaction with a lower cost to their bundle. So I've talked a lot about technology in general. I kind of want to give you a little bit of an idea of what we are as a company. So we have kind of 3 components that kind of built up our company. We have a component of technology that goes into the patient home. So you can see here on this little table here on the left kind of picture, or on the right picture, this device goes into the home of the patient. And what it does, it provides the technology that the patient needs. So all we need from the patient is a plug in the wall. The system itself has sensors that's looking at 22 joints in 3D space. It's using a 3D sensing camera that also not only assesses and quantifies the motion of a patient, it also records a video of the patient, which the clinician has the ability to review and look at to understand and triage at their own time how that patient is doing and what that patient is doing at home in between those in-person visits again. Again, we also provide a cellular device in there, so if the patient doesn't have Wi-Fi at home, that's okay. And the real benefit of all this is that it's really a simple technology where the patients don't have to don and doff anything. All they do is tap the screen to wake it up, they tap the screen to start it, and they stand in front of it, and Vera, the system, will guide the patient through the prescribed program that's given by the overseeing PT or clinician, telling them what to do in terms of exercises, telling them what to do in terms of patient-reported outcomes, like the HOOS, KOOS, WOMAC, all the standard patient-reported outcomes that are out there, doing some remote patient range of motion measurements or functional testing for sit-to-stand or balance tests if they're appropriate, as well as giving them valuable educational materials and asking them questions so that you understand. So what we do post-surgically, we will ask them questions about their, have they had a bowel movement? Are they having any increase in a fever, right? Potential fever? Are they having any significant increased pain? So as they interact with Vera, who is kind of an interactive avatar, they answer these questions. All of this is bubbled up to the clinician app, into that. So again, when I look at that, again, there's three components. The Vera Home Unit, it's the clinician portal, which is web-based, which you can access on any browser that you can log into. You log into a HIPAA-compliant server that pulls down the data and the information, where you have the ability to do population management and triage and understand, again, what that patients are doing. And then the last part is that live video teleconferencing part. So we have both as we call it, a synchronous live conferencing ability to do it, like a Skype, HIPAA-compliant Skype conversation. And we also have the ability to do the asynchronous, where we do the kind of store forward aspect, where the patient does the activity, interacts with Vera, interacts with the machine at home, and all of that information comes to you, where you can, as a clinician, have the ability to review that data at your own time, and again, quickly bubbling up those patients who may need your attention. So this is, again, another look at it. It's basically 18 inches by 18 inches. It weighs less than 15 pounds, and it's something that's really light and mobile that can be used in the patient's home. Very easy to set up. So when we kind of talk about this, the patient journey, as we talk about this PT Navigator or whatever, it's basically, it's really creating a concierge type of care for that patient, really interacting with them, where they're getting feedback or understanding what they're doing at home, how they're doing, what they're doing. So you can imagine, as this kind of shows here, the journey is really, this navigator interacts with the patient prior to surgery. That's where we do with a lot of our programs, even home health. What we're doing, they're working with their partners, and they're learning to understand some patients who will be coming to them post-surgically. So they're actually interacting with those patients pre-surgically now to kind of just say, introduce them, set expectation of what's going to happen post-surgically, and which allows that patient to familiarize themselves with the whole clinical flow or the whole kind of recovery experience, as well as the technology prior to their surgery. So what that does is that PT Navigator, who would be at your facility, kind of interacts with them, sets a little prehab program for them. They kind of understand do all their pre-surgery, I would say, education and checklists to make sure they're on course for their upcoming surgery and everything's going well. And then once they have surgery and everything's good and they come back into your care, that's where you kind of set up and do that interactive care again, where you set up the post-surgical program with them, and then they understand the expectation of them having to do daily activity or exercise at home with Vera. And where then it's more of a coordinated care effort where the navigator is communicating with the in-person PT if needed, or even with as you guys already do, with the physician's office as needed if anything needs to be escalated. As we've done this with thousands of patients already. We've worked with Yale University, Cleveland Clinic, the Duke. We just done that. We worked on the West Coast here with organizations and hospitals on the West Coast here, like USC. And when we worked at that, patients really enjoy that experience. They find that it's really convenient. They love the accountability that they have with a clinician, and that's why we're seeing net promoter scores around 87. And that's really, net promoter score is a kind of it's a tool that's used to assess services. Will people recommend your service to others based on their experience, to family and friends? And when you look at that, when we think of high quality products out there like Apple and Amazon, they get in the high 60s and 70s. And 70s and up is considered to be a very high quality service. And what we're seeing is that our net promoter scores are up in the 87 when used. The clinical experience that the patient is receiving from the PT with the technology is up around 87 or higher. Why does this really work? I think what it does is that they see that accountability. They understand it's very simple and easy to use. They feel that they have a better connection with their therapist. So they understand that their therapists are actually understanding what they're doing beyond the in-person visit. So when they do have those in-person visits, it's more focused to what they have done after they've been with them. So rather than kind of doing that detective work that we all do when we go into the clinic, and it's really making them, they develop that connection with Vera, to say that she's waiting for me, a lot of them say, and they want to know, and because she's giving them feedback. So when they do the exercise, as the system is evaluating them, for example, doing a squat, and if they are not doing a squat quite ideal, so if their knees are going in front of their toes, or if their knees are coming a little inward, the system will give them that feedback. So it's much more interactive than a piece of paper, and it's much more interactive than them watching a video. So it's telling them what they are potentially doing incorrectly to help them move better and hopefully recover even better, along as you adjust their program appropriately. When we've done some studies with the Cleveland Clinic, and when they looked at this, what they looked at when they combined this navigation model where they use this hybrid model of PT Navigator with in-person visits with the technology, they really drove that high adherence to the program, really high potential patient satisfaction, and because they had the biometric data, it really helped them to provide a custom plan for that patient. And when they looked at that data, they did it for almost close to, I think the total experience was close to 200 patients of total joints. The one in this actual particular study here was closer to 160 patients. What they were able to see, they were able to get better adherence compared to the traditional folks, what they've had. It wasn't a pure randomized control, this experience. This was more of an observational study. I think the big thing here, which I found interesting as a PT, the clinicians themselves were now prescribing more exercises for the patient to do, and a higher variety of things to do, getting that patient to do a little more than what we traditionally do at times. And they were having them to do 14 to 15 exercises once or twice a day, not doing 3 sets of 10 or that type of thing. They were doing like 1 set of 10 to 12, but making them do a variety of different motions because the patients felt engaged, and it was driving them from the patient to do A through Z because they had that accountability to their therapist, because the therapist would do a check-in with them and say, hey, you didn't log in yesterday, just checking to see how things are going. What that really helped them to drive to do is make them move, right? Again, like I said earlier, PT is extremely helpful and critical for the care of the patient, but at times it's not rocket science. And the main thing is to really get that patient to move beyond the time we are interacting with them. Patients on average were doing 26 minutes of activity a day between and during their sessions, or in between their sessions. This, I think, helped to drive their lower length stay in rehab to roughly 30 days versus their traditional folks, which is 55 days. And as we look at the technology that we're providing, it's really more than a phone app per se. I spoke about earlier to you all about our trial at Duke University. I didn't share that data with you right here because we are actually just got that data a month ago, and we're in the midst of publishing it, so I can't really share it publicly. But what I can tell with you as an overall thing is that when we looked at the trial, our primary outcomes, our primary analysis was for cost, with at non-inferior outcomes and patient satisfaction and safety endpoints. We hit all of those measurements, so that we were able to show significant cost savings, almost 60% in cost savings. And I think a lot of that was attributed to a lower readmissions and lower urgent care visits. So that helped to drive better costs and a better kind of management of in-person utilization. And all of that was done with non-inferior outcomes at 6 and 12-week measurements for range of motion, pain, patient-reported outcomes, as well as gait speed. I looked at all of that at 6 and 12 weeks post-surgically. And with that clinical oversight, using the technology, I think that helps to drive. That's the difference here when you compare it to a phone app where you have videos and you can log in and say, I did something. I think the ability to hold that patient a little more accountable because you have a recorded video of their home, of what they're actually doing, what their home environment looks like, how they're doing in terms of engaging with patient education materials. All of that stuff drives a better adherence and drives and leads to better outcomes. That's really all I have to share right now with you. I'd love to kind of answer any questions that you may have. Here's a little bit of my contact information again. Again, my name is Anand. I'm a physical therapist, and it's been a pleasure speaking with you.
Thank you so much, Anand. So again, a reminder that even though you're still in Mute Only, we can ask questions. You just go to the sidebar of the webinar piece and you just type in the questions tab. While we're waiting for any questions to come in, just a reminder, this was recorded, so it will be made available after it's processed. So most likely later today, but possibly tomorrow morning. But it will be made available for a good amount of time. So if you want to, listen to it again or send it to a staff member, that's absolutely okay with us. And yeah, so while we're waiting for any questions, if they are going to come in, Anand, did you have any final thoughts that you wanted to leave us with, or?
No, I think, as we talk about this, most of our population when we worked on, it's total joints, right? So there's always a fear that seniors can't use technology, right? And I think there's a lot of studies out there that are showing that. Not only have we done studies with the total joints and the total joints aspect in the world, we were fortunate as a company to have received a grant from the CDC for fall prevention. So what we've done too, we did a fall prevention study where we got a $1 million grant from them to digitize a fall prevention tool called the Otago tool. So it's a clinically proven tool to have shown to decrease patients' fall risk when used independently on their own over a 6 month, I think an 8 to 12 week or 6 month period. So what we did, we digitized that tool and say, can they use technology to do that? And we actually put this technology into senior centers in San Diego as well as in North Carolina, and looked at that. And what we found is that patients it showed the same effect where we were able to reduce fall risk in the high-risk seniors, patients who had even our population, which we did with 50 patients, they all were screened with the MOCA, and overall they had mild cognitive deficit as well. They were still able to use this independently on their own, log into the system, use it at home at the facilities as they came in for their interactions at these senior centers. So we've deployed this as well in some ALFs in LA as well as down in Jacksonville to use this as a way to help with fall prevention in ALFs and as a way for those people who could benefit from this as well.
That's great. We actually have a couple of questions for you. The first one is, did any of your geriatric clients have difficulty maneuvering that level of technology to use Vera?
Yeah, so, no, not at all. That's what I'm saying. So, it's surprising, you would think that, but I think these days everything is, the seniors are more adaptable. They're getting used to technology, number one. Number two is we also, in San Diego here, we do a lot of usability studies and work. You know, I mentioned earlier about the West Health Foundation, where we kind of came from. They do a lot of work in San Diego of providing care to low-income seniors and helping the impoverished seniors with their just normal services of just giving them food, dental, basic medical services for free. So we do a lot of usability studies with that population. We bring them into our offices, we go to them at these senior centers and work with our user team works with them to make sure that this is not only easy, can they use it, but it's really simple and easy for them to hook it up, and to tap it to go. It's really a touch screen. It's like it's simple an iPhone. You know, people say if you can, it's less complicated than logging into your TV, because with your TV you have multiple things you got to change inputs to. This is all, you tap it, and then you tap it, you stand in front of it, and Vera tells you what to do. That's it, and you just do it. There's no type of thing where you have to change inputs for a screen or doing any type of formal logging in with email address and all that. It's a really simple touch screen experience.
Perfect. So the next question that we have is, typically, is the Navigator PT a home care agency employee or a contracted service? And how are home PT versus Navigator disagreements regarding needed visit frequency addressed?
Yeah, great question. That's a great question. So, when we've worked with our current customers at Home Health, so for example, the Visiting Nurses of New York, they are doing the navigation themselves. So they are doing it's their own staff that's going into the home, and their rehab managers doing the navigation. So they kind of work together to find the optimal visit number for that patient. They're working with their providers to understand, with their sort of referral sources, to help them understand that this is an enhanced care, more where the patients are getting more touch points, and doing that. At the same time, for other entities, we provide the home health. We provide the navigation model, and that's included in our currently included in our price, where we will manage the patient for you, communicate with that patient, and then communicate with the PT. And everything is driven from the physician down in terms of what's clinically needed for that patient. And kind of, as we all know, helping that patient get to the next level of care in that continuum of their rehab and recovery. And so if we can, we will work with not only the home health agency, the following outpatient model as well, working with an outpatient team to make sure that that care is that patient has that unified person to help them through that rehab continuum.
Great. So it looks like that's it for questions for now. Obviously, if anyone has any questions moving forward, Anang's information is here, but also you can email me and I can get you in touch with him. So I thank everyone for calling in today. Anang, thank you so much for sharing your product with us. I know you spoke, we had this topic at our Leadership Summit last year, and it was very well received, and we thought that it was a great opportunity to share more information with our Massachusetts members. Thank you all again. You'll be receiving the recording again, most likely later today, and I hope everyone has a great rest of their days.
Thank you, Megan, for the time. Thank you, everyone.
Thank you.